Amy Schumer is an American comedian, actress, and writer, known for her sharp wit and often edgy humor. She came out publicly this year that she had Cushing syndrome. Cushing syndrome is a medical condition caused by prolonged exposure to high levels of cortisol. Cortisol, a steroid hormone produced by the adrenal glands. It is important for regulating various body functions, including metabolism, immune response, and stress response. However, when produced in excess, it can lead to a range of health issues. The following is a list of negative effects that can occur from prolonged elevations of cortisol. 3 key changes in physical appearance are weight gain, particularly around the stomach area, facial changes, particularly developing a rounder face often referred to as moon face, and buffalo hump, which is a fatty hump between the shoulders. 3 key changes in skin are purple or pink stretch marks, thinning skin, making it more prone to bruising and slower healing, acne, and increased facial hair, especially in women. 2 key musculoskeletal changes are muscle weakness, particularly in the upper arms and thighs, and bone loss, leading to osteoporosis and an increased risk of fractures. Key metabolic and cardiovascular changes are increased blood sugar that can lead to type 2 diabetes, increased blood pressure, high cholesterol, body fat can lead to higher risk of heart disease. Key psychological and cognitive changes are increased depression, anxiety, and mood swings, difficulties with memory and concentration. Key changes in the topic of reproduction. In women, menstrual cycles can become irregular or stop altogether, reduce sex drive in both men and women, and difficulty conceiving due to hormonal imbalances. Other key changes are weakened immune system, leading to a higher risk of infections, increased risk of developing ulcers in the stomach and intestines, and increased incidences of acid reflux. Cortisol can be increased by an internal or external source. Internal causes can be caused by different kinds of tumors that can directly or indirectly increase cortisol levels. The following are a list of external sources that can increase levels of cortisol. Prolonged psychological or physical stress can lead to elevated cortisol levels as the body responds to stress by producing more cortisol. While regular, moderate exercise is beneficial, intense and prolonged physical activity can lead to temporary increases in cortisol levels. Severe illness or major surgery can trigger the body's stress response, resulting in elevated cortisol levels. Chronic alcohol consumption can lead to increased cortisol production. Long-term use of medications like prednisone, dexamethasone, or other glucocorticoids for conditions such as asthma, rheumatoid arthritis, lupus, or inflammatory bowel disease can lead to elevated cortisol levels. Management of elevated cortisol depends on the underlying cause. Treatments may include reducing or discontinuing corticosteroid medications under medical supervision, surgery to remove tumors, medications to control cortisol production, and lifestyle changes to manage stress, diet, and exercise.